Hey everybody, it's Dr. Shawn Tassone, America's Holistic Gynecologist, coming to you from Confessions of a Male Gynecologist with my guest, the ketogenic nutritionist, Temple Stewart. Thank you so much for coming on. I know the ketogenic diet is kind of one of those things nowadays that is kind of getting a lot of, with the carnivore and all that stuff. But obviously, you being an actual registered dietitian, I think have way more credentials to talk about stuff like that and how certain supplements and things affect your body. Why don't you kind of let everybody know what your background is, how you got to this ketogenic kind of way of life?
Yeah, and thanks for having me on. I'm excited.
Sure.
My journey it really started as a kid. I grew up in South Mississippi, so lots of rich food. I never really had any glaring health issues as a kid, but I was always super active. I played college soccer and it was always very, very busy. And so, I was always kind of the chunkier kid. Which looking back now, there were definitely some red flags, but really when I realized some things were off was about my sophomore year of college soccer. And I didn't have a period, and I had never really
Right.
investigated this. But all my friends were like, yeah, I'm regular to the 28th day, like everything's normal. And that was just not me. I had started a period, but they were few and far between. When I would have one, it was painful. It was horrible. And so I did the whole thing, went to the college nurse practitioner, got on birth control because that was the only thing that they did. No labs were taken or anything like that. I continued on my college athletic path, and just kept gaining more and more weight. And so that initially raised a red flag because I'm thinking, I'm doing two-a-days, I'm lifting a ton of weights, but here I am with all these weird symptoms of weight gain and acne. I'm a bit of a mess. And so, I was always interested in nutrition. And so I started going the dietitian route and I changed my diet a little, but I was really more so following your standard recommendations of more whole grains, more legumes, more of the starchy carbs. And for what my body was experiencing, that just wasn't it for me. So things just continued to progress. I graduated college, was no longer quite as athletic. I still worked out, but just not at force like it is in college athletics. And
Right.
so my first year as a student dietitian was really when things went really haywire. I probably gained about 40 pounds. I had no period. And I was just frustrated because here I am working in the hospital, the VA hospital, telling people how to eat, but I'm having all these health problems and I feel terrible and moody and all the things. And that's when I booked my first appointment with OB. And so, that was the first labs that had ever gotten pulled on me. And sure enough, came back pretty classic PCOS case. Started doing all the things I was told, metformin, spironolactone, continue birth control. And I remember asking, hey, is there anything I can do lifestyle diet wise to help me out here? I'd really love to eventually have a child, and all these things. And I just kind of got a flat effect of like, no, you're not going to be able to get pregnant super easy. Just come back when we want to cross that bridge. So I kind of accepted that for a couple months and the metformin did all the things, but it really didn't help. And that's when I started kind of my own investigation. So
Mhm.
to make a super long story short, I essentially stumbled upon a few books. Why We Get Sick by Dr. Bickman, The Obesity Code by Dr. Jason Fung, some of those that just kind of shed a new light and were obviously alternative to what I had learned as a dietitian. And I started implementing a lot of these things. And sure enough, my period came back within like the first month and a half. I stopped gaining weight and was losing weight pretty quickly. Mood swings disappeared, acne disappeared, all the things that I had struggled with since college. And here I am kind of doing the opposite of what I was taught as a dietitian, and it was working. So it's a bit of imposter syndrome, and kind of confusing at the time, but now looking back, I'm really glad that I got into this low carb ketogenic realm. And it's kind of morphed and has had several different versions, but that's ultimately what I believe led my body down the healing path. And my cycles return now; they're completely normal. I ended up having a little one, breastfed, the whole thing that you're kind of told is really hard with PCOS. Just wasn't for me. And so yeah, that's kind of the long story of how I got to
It's
where I
great.
am.
No, it's great because, I can I can probably count the minutes on my two hands how much nutrition I got in medical school and residency. And, you're talking to a woman like you who has PCOS, and my gut 25 years ago would have been put you on birth control pills, which doesn't fix anything, as you're well aware of. And with PCOS, we're dealing with insulin resistance, right? I mean, that's the main thing. And so for you to have discovered this, even with your dietary, you had to go outside and figure this out yourself, and it's the same with me. And my training is even substandard to what you did and all that stuff. And I'm coming to this a little later to the party, but with that, you ketogenic, glucose metabolism, insulin, and the medications that are getting the main storylines now with the GLP-1s. And a lot of patients don't want to obviously go on those cost-wise side effect profiles and things like that. But then I kind of stumbled upon the Berberine initially. And from Berberine, I kind of transformed over to dihydroberberine. And we're going to talk about that. But I kind of, I found a guy named Shawn Wells, who's a friend of mine, and he kind of discovered dihydroberberine. So I went deep on those. But I kind of, a lot of my patients, a lot of my listeners, because I've done a couple podcasts on berberine and dihydroberberine, but I kind of wanted from you, like, what is your experience as a dietitian with dihydroberberine?
Yeah, well, I initially started taking it pretty quickly. I wanted off everything. Not that I have anything against pharmaceuticals, but they weren't really helping, and I really prefer to do it, from more of a holistic, natural standpoint.
Right.
And so I initially got into berberine, and was taking that pretty early in my PCOS journey. I would say within the first 4 to 6 months. And
So that was a while ago.
Oh yeah, a long time ago. Like this was all around 6 years ago,
Oh, wow.
and I
I
had
didn't
no
even know
idea.
it was around that long
Yeah,
ago.
yeah, yeah,
Okay.
yeah. I found it at a local Sprouts, and I
Wow.
just knew that I knew nothing about it. I just knew
Right.
that it was under the blood sugar
What
metabolism
category?
thing in Sprouts, and so I was like, I'm gonna get everything. So I
That's
remember
right.
grabbing cinnamon and some other things,
Mhm.
and the regular berberine was fine. I did notice that it wasn't quite as hard on my GI system as metformin was. So I was really
Yes,
just kind of like, okay, well,
definitely.
I'm going to stay on this from then on. And then, I started combining it with other things like inositol. This was a little later on down the journey.
Yep.
And that's when a lot of the kind of secondary symptoms of PCOS really started to improve for me. And obviously I'm combining this with lifestyle and diet, and so I'm getting these like magnified results. I was getting results that I couldn't get in the hospital with my type 2 diabetic veterans and all of this. And so I really started to think, God, there's something to this. And then I started looking into some of the research later on down the road. I'm like, what are we doing? Why is this not like first line with women with PCOS? I'm getting all these questions on Instagram and all this. What are you doing? What are you doing? And I'm like, well, I'm taking berberine, I'm taking inositol. And so, I just think it's a good adjuvant to what we're doing here, and it's safe. And so I made the switch to dihydroberberine just mostly because of the GI. A lot of my clients
Mhm.
started to have GI side
Yep.
effects. And so I was like, well, let's look into see if there's anything that's a little easier. And that's when I stumbled on Endure and dihydroberberine itself.
It seems like the progression, because it's exactly what I experienced in my practice, was that I started prescribing metformin. And as a doctor, metformin can be kind of nasty. I mean, it definitely has diarrhea and stomach pain as a side effect. But then initially, 20 years ago, 15 years ago, because it was getting prescribed a lot for patients with PCOS, it also has something called aplastic anemia as part of its side effect profile, which is where
12.
your bone marrow stops making blood cells, which is life threatening. And I've
Yeah.
never seen that personally in my practice, but it freaks you out a little bit. And so it's not one of those things that you can just prescribe wantonly for somebody for months on end. You want to check in with them. You got to do blood tests every once in a while. And so my progression to berberine was out of the fact that I didn't want to have to keep doing that. And so you start looking, and head-to-head studies with berberine and metformin were fairly similar. I mean,
Very.
with PCOS patients. So when you make that switch, I think the big thing too that we look at as medical professionals is you mentioned the issues with berberine, and what I found anyway is that dihydroberberine is way better tolerated in the sense, and it's also better absorbed. So
100%.
in the people that you put on dihydroberberine, do you notice that do they have better results, and do they have just less of a side effect profile?
100%. And so I even, yes. So, I think the studies are it's like 5 times more bioavailable. It has a longer half life. So it kind of stays in the bloodstream longer, can manage that blood glucose longer. I, Yes. So to answer your question, I see way less side effects with that. I haven't had one client since starting to use dihydroberberine have to come off of it due to those side effects. And so, that is my main motivator as well. And like you, it's much easier to just give something like that you're not having to send people to go get labs and worry about B12 deficiency and all these other things that come alongside some of the metformin profiles. So yeah, I haven't had anyone have to come off dihydroberberine. I've had a couple that couldn't tolerate the regular berberine,
Hmm.
but not dihydro. And I made the switch, and I've taken dihydro on and off for several years now, and have never had a problem.
So for the nerds out there, and there are a few, but dihydroberberine is actually a metabolite of berberine, and your body has to break down berberine to turn it into dihydroberberine. So that's why for some people they probably can't do that transaction very well in their bodies. And yes, there have been studies done that have compared berberine versus dihydroberberine, and plasma levels are higher if you take dihydroberberine. And the interesting thing is, berberine's a 500 milligram dose a few times a day, and the dihydroberberine is 150. So it's a little bit less of a dose because it's better absorbed. Now, I use it in my clinic for a lot of things, PCOS being one of them. I also use it in those women that aren't quite ready to make the jump to GLPs because of the
Sure.
costs or the fear and things like that. And what I've noticed is even changing absolutely nothing, if you change nothing else over a 3-month period, I see women lose 5 to 8 pounds just adding the dihydroberberine.
Hmm.
But I'm curious, like and I actually use it too if I have patients on GLPs, because I find that it helps with inflammation. It helps with cholesterol levels, especially in women that are menopausal, that have high cholesterol, and there's fear around statins. So I use it a lot, and I do find that the numbers do shift. So I'm curious, like what you see in your practice.
100%. I see lowered inflammation, lower CRPs. I think it's good for lipid management. You see the drop in triglycerides, your increase in HDL. I think a lot of people too can see some of the gut microbiome improvements with it as well. So, I do think it's a good bridge for those that are either wanting to avoid GLP-1s or even coming off of GLP-1s and they're worried about that weight regain that is so
Yep.
frequent.
Yep.
I notice a lot of appetite regulation with it as
Uh-huh.
well. People will straight up say, like, I'm not having those cravings, especially the week before the period. So, like, some of those things that can be huge barriers to people's health, weight, all of that, you see kind of go away. It has, really good cardiovascular benefits. I'm seeing lower blood pressure.
Blood pressure, yeah.
Yeah, and now they're showing it's can be used, quote unquote, for longevity, which I think is really pretty cool without some of those side effects. So yeah, I'm seeing the same things you are. A lot of my patients wear CGMs as well, and so it's kind of interesting to see, like, head to head. If you eat a piece of cake on an empty stomach, or if you eat a piece of cake while taking
Are you
dihydroberberine.
condoning cake now? Because I'm all for. I'm
No.
for it. I'm all for it. I'm here. I'm
It's
ready.
all for the data. It's all for
Okay, it's for
scientific
data. Okay.
data.
Well, I'd
Yeah,
be
yeah.
willing. I'm willing. I'm willing to do that. Yeah.
Yeah, yeah, but some of the stuff and advice that I give my clients is like, I think there's something to nutritional quality of life, and the date nights and the birthdays and the fun things that we do. I think sometimes if you plan well for that, and take a little bit of berberine before you go have a piece of cake, it's very it can be helpful. And I'm certainly not saying lean into that as your only modality,
Right.
but for sure, like, even when I've worn CGMs, I can see a difference in, even that fasting blood glucose. So I think sometimes it not sometimes, it's just one of those things that you can implement and see a big difference without having a huge, barrier to entry.
So the other thing that's interesting is, and I'm sure you do this too, because people ask, like, well, okay, dihydroberberine, that's great. I want to try it. What do I buy?
Yeah.
And I am what I call a supplemental purist. I don't like proprietary blends because I just don't think you can get a medicinal amount when
Mm-mm.
you've got 35 things in there. And like you said, they'll throw in cinnamon, they'll throw in inositol or myoinositol, and you can't, the pill would be the size of your head. You can't do all that in a little pill. So I always go on the lookout for good companies. I try to, companies here in the U.S. and then that just do single ingredients. I just love single ingredient supplements. So I stumbled upon endurance products, and the people that listen to me know I talk about them all the time. And I just love the fact that they are single ingredient supplements. And like when you call them, it's like, because I did this because I'd been using them for like a year and then myself. And then I just called them because I wanted to talk to them. And then like the dad answered the phone. It was
Yeah.
like, it's like a family owned operation. How is it that you kind of got to endurance?
I was looking for dihydroberberine, and there's not a lot of trusted companies out there that are
Hmm.
producing. Like you said, I'm a little bit of a purist when it comes to this, and I get real sketched out by a lot of the things on
Oh, yeah.
Amazon, and and so I was really looking for something that I could feel confident in recommending, and something I could feel safe taking myself. And that's I essentially stumbled on them in Full Script, which is a good
Yep.
software, to find some of these better companies. And I'd never heard of them before. And so I reached out and followed them on Instagram. And then that's when I got kind of plugged in and learned a little bit more about their philosophy. Like you said, family owned, made here, very high quality ingredients. Like you said, oftentimes it's single
Hmm.
ingredient supplements, and really they're the only ones doing dihydroberberine right. And
Yeah.
so that's how we kind of got plugged in. And I truly believe berberine is one of the supplements that is not, it's not a waste of money. People are buying so much supplements, and we're getting marketed to online all the time. You drink this cortisol cocktail, all these
Oh, yeah. The
things,
cortisol cocktail.
the whole gamut. And so I was getting frustrated with a lot of that as well. And like you said, with the proprietary blends, if you break those down, you're absolutely correct about vast majority of supplements are insignificant
Yep.
dosages with the proprietary blends. And so yeah, very similar to what you did. And then I started recommending it, and my clients were having great experiences on it. They're watching their blood glucose drop, they're watching their blood pressure go down, all these things. And I'm like, all right, well, let's do this, because I'm happy to get behind a supplement company that's doing it correctly.
Yeah, and there aren't many. Like, I talk about Symphony because I like their maca based product. And when I try to find something like you said, I went out and I looked at dihydroberberine. But I went backwards and I called my friend Shawn, who kind of came up with the dihydroberberine aspect. And then I asked him, like, what companies would you work with? And with this glucovantage, that's the trade name of
Hmm.
dihydroberberine. And he immediately pointed to these guys. So I was like, okay, well, let's check out endurance. And then I was like, oh my God, it's a single ingredient. I was like so excited because I figured it would be some proprietary blend, but no, it's single ingredient. And then I started looking at it and I started using it in my PCOS patients. But I'm curious on your end, do you use it for any sort of preventive measures? Like, I see it on my end when there's already a problem, like insulin resistance and whatnot. What do you see preventatively? Like, how do you use it?
Yeah, well, obviously, with there's a problem too. I pull labs on every single one of my clients. So
Okay.
anybody with a higher COP, anybody with fasting insulin over like 6, 7,
Okay.
any of those kind of like red flags, for me, it's a no brainer, because it's a very simple change, and it can often modulate some of, or not modulate, but it can help kind of bridge the gap for those clients and those people into better eating habits. Like I mentioned, it seems to be very good at appetite and kind of manage. Obviously, we know when our blood sugar is stable, we're not having those big swings, those cravings, those needs to go get something quick, fast, and convenient. And so it has just been a very good thing to add in with my clients. But like I said, because of the vast benefits of it, I know we keep going back to blood sugar and insulin, but it
Yeah.
really does improve lipid panels. It really does improve those inflammatory panels. And a lot of times those are the hardest things for people to get movement on. And so, yes, I use it preventatively, or even if we're noticing trends that I don't like, the lowering of HDL, the triglycerides that start to creep up over, 90 or so. I will tell them, hey, this is something that you can get started on that really has no risks that I'm, aware of in terms of
Yeah.
drawbacks to start doing. That's an easy change and an easy thing that doesn't require a ton of, effort on their part.
Yeah, the only thing that I have people do is go on it for 3 months, and then I'll have them go off for a couple of
Yeah.
weeks because it can interfere potentially with vitamin B12 absorption. So
Hmm.
maybe it does, maybe it doesn't, but I just will cycle people off. But
Yeah.
if I had to pick my top 3 or top 4 supplements, I would put endurance in there with dihydroberberine. I'm a big fan of maca for women's health stuff, and I
Hmm.
use a company called Symphony. And then I'm a big fan of omega-3s.
Yep.
Currently, I like to use algae oil, which is kind of the precursor to fish oil because that's what the fish eat. And a lot of people don't like the fish burps and stuff like that. So I tend
Sure.
to use algae oil. But I'm curious, what do you use? So, like, you use a lot of dihydroberberine, but what things do you pair that with? You'd mentioned inositol, and I used to use inositol as well and still do for PCOS, but I'm just kind of curious what your big supplements are.
Yeah, I definitely do a inositol based on their panel, or what we're seeing with, the higher DHEA, the higher androgens, et cetera. I think it's very helpful for that. Creatine is definitely in my top
Yeah.
three. Just with the newer research coming out about visceral fat and lean muscle mass protection,
Do you
especially
use
the
creatine even in people that aren't working out? Like, let's say somebody who's not lifting heavy weights, you still use creatine?
For sure. The research on the cognitive benefits are outstanding,
Oh,
especially in like
okay.
my peri and menopausal women. But even so, like your weight loss and just longevity, typical classic case, I think it's awesome. With in terms of lean muscle mass protection, especially during weight loss. So this is a one I
Yeah.
definitely have my GLP-1 clients on for
Okay.
sure. Yeah, I'm a
You do like
huge
5 grams a day, or what do you
I do
do?
a loading phase typically just to replenish. So if it doesn't cause any nausea, sometimes this is the drawback of doing high doses of creatine.
I
And
get itching. Have you ever heard that?
no, I have
Yeah.
not
Just,
many. I guess I have, but not too many.
okay.
You may try a different form.
Yeah.
Sometimes, yeah, sometimes you can switch the form to HDL, and then that will help a little bit.
So are
But
these, you're not talking creatine monohydrate? There's different forms?
there's several forms. Yeah. So
Oh,
if you don't
okay.
tolerate monohydrate well, like if it causes GI stuff,
Okay.
but I typically do like a 2 to 3 day loading phase of 10 to 15 grams. And then
Oh,
we'll
okay.
just go back to 5 grams. Cause after that loading phase, you're going to pee most of it out anyway.
Okay.
Migraine sufferers can actually do more for longer periods. So it's really
Oh,
good for migraines as well. So yeah, I
interesting.
use creatine is definitely in my top three. I'm with you on the fish oil as well. I think that's extremely beneficial and anti-inflammatory long term. Very well studied as well. I'm trying to think of any others. And then I I play around a lot with adaptogens and nootropics and things like that based on
Yeah.
the individual's symptoms. If I'm getting someone estrogen dominant, I'll use DIM. If I'm getting someone low progesterone, I'll use a little bit of wild yam. So, there's so many that I use kind of based off of lab work that I'm getting, but I would definitely say fish oil, dihydroberberine, inositol, and creatine. I kind of want to find another one just to make it five, but
Well,
that's like my
I'm
top
gonna
four.
give you two. I want to know what you think. The first one that I want to ask you about, if you know much about it or if you've used it, is methylene blue.
Yes. Wow. You're opening up that can. Yeah.
Well,
So
it's because it's getting a lot of press, and
it
unfortunately,
is.
there's people dropping it in everywhere, and there are some side effects with it. When
There
I
can be.
started my practice, we use methylene blue in my practice. You actually would put it on the vulva to get rid
Interesting.
of skin lesions because it can do that. So it's like, when I heard about people eating it, I did the deep dive, and it's got great things, but it's also got some negatives. So I'm
It
just
does.
curious.
Yeah, so I'm actually a third year naturopathic
Oh,
in MD is what we call them,
good for you.
student.
Yeah, good for
Yeah,
you.
and so NDs use methylene blue a lot. I think it's good for several things. I think it's good for long COVID. So anyone struggling with
Oh,
that like brain fatigue,
yeah.
like brain fog, even in some of your like Hashimoto's autoimmune Obviously you got to be careful with the dose. You got to make sure there's not a glucose 6-phosphate
Yep.
dehydrogenase deficiency. So you
Yep.
can't just be doing it willy nilly.
You could kill those people.
You literally can. You
Yeah.
literally can.
Yeah.
So I think like use with caution. Most of the ones that you can get kind of over the counter, like some of your brands online, are so low dose.
Yeah.
But even so, it's pretty expensive. So yes, I'm open to it. I think proceed with caution. I
Yeah.
think it's interesting. I think I would be real curious to see kind of what we look at. Or I would love some more research on it in some of
Yeah.
these different populations. But yeah,
You
I'm
got
open to
people
it.
doing it IV and all kinds of stuff. It's like,
Yeah, I don't know. Yeah, yeah, I think proceed with caution, but I
that's what I
have
think.
seen it be pretty impactful in some of your
Yeah.
long COVID. I'd be curious to say the other one. I don't know if you consider it a supplement. I'd be curious to hear your thoughts on it. Is like intranasal glutathione or
Mhm.
additional glutathione. That would be another one I think I like. Again,
Yeah,
proceed with caution.
can help. And the one that I've been kind of diving into that might sound weird as a physician, but I'll tell you what, for nootropic brain health thing is small doses of nicotine.
Nicotine.
Yeah,
I knew
see?
you were going there. Yeah, I knew you were going there. Very interesting, very cool. It's combined with methylene blue often as well. So
Ah,
people,
yeah,
people will combine the two and they'll do like a very low dose patch, like a 1 milligram or even
yeah,
less nicotine patch. And then they'll combine that with methylene blue. But there's some interesting stuff with that in some of your neurodegenerative diseases,
yes,
Alzheimer's and stuff. So I think
yes.
it's definitely one of those things, like obviously proceed with caution with nicotine. We're not certainly not saying go smoke a pack of cigarettes to get your
Well, no, but
nicotine.
we're talking about like a nicotine salt or a patch, so you don't have
Yeah,
tobacco. A lot of the negative stuff comes from the
smoking.
tobacco, and
Yeah,
when we say 1 milligram, that's like I think like a third of a cigarette or something. It's like not
very
very much,
slow. Yeah,
you
very
know.
low and slow
And there's
doses.
no tobacco involved, but
Right.
and like you said, Alzheimer's and some of these degenerative diseases have actually shown some positive results. So
Parkinson's. Yeah, it's super interesting. And I'm typically for any tool that doesn't have a lot of drawbacks, but that can change people. Some of these things can really change people's lives that are suffering with these debilitating diseases. And so yeah, I'm all for it.
So getting back to the dihydroberberine because of the PCOS type stuff, do you see any sort of other things we could use it for? Like, I said earlier, the statins have such negative
Yeah.
press about them and they have side effects like rhabdomyolysis and, the muscle and joint pain and all this stuff. And a lot of people can't take it because of liver stuff. And do you see dihydroberberine in the future maybe moving into those areas?
For sure. Definitely going to put almost all of my non-alcoholic fatty liver disease patients on it, my high blood pressure patients, my dyslipidemia, or people with weird or hard cholesterol that's not moving. So yeah, absolutely. And again, it kind of goes back to that low risk. It's just so low risk. It's kind of like a no-brainer for me in terms of why would we at least not try it. Some people too, even like your SIBO
Mm,
clients, or that are having a lot of this like weird digestive disorder
yeah.
stuff, that sometimes because berberine can work on the microbiome in a
Yep.
beneficial way, it can really improve a lot of these things. And again, I don't know anyone who can't benefit from a little bit of lowered inflammation, right? Our environment that
Right.
we live in is inflammatory in general. And so I hope so. I would love to see it become much more mainstream. When I originally saw my OB, I was basically begging for any information at that point. I wanted dietary information. Give me all the supplements. Give me anything I can do. And it's still shocking to me how many women come to me after seeing conventional medicine practitioners that aren't up to date with this stuff and have no clue what even berberine is. And so absolutely, I think using it in some of these conditions is well worth it. And we know insulin resistance has got its webs in just
Oh,
about
yeah.
every cancer, everything under the book. And so it's to me, again, it goes back to being a bit of a no-brainer.
I'm curious because, you mentioned the gut microbiome. A lot of women that I see will say, "Oh, I tried berberine, it didn't work." Well, a lot of these women also have gut dysbiosis or they have their guts inflamed. you actually have to convert berberine into dihydroberberine, and your gut microbiome does that. So for women that have tried berberine, I would challenge you to consider the dihydroberberine, because you don't need that gut. So if you do have gut that's got a problem, you can still use dihydroberberine, because it
Yep.
doesn't need to be broken down, because it's already the metabolite. So when people say, oh, it didn't work, well, it could be because your gut was just in a really bad place at that time. So I'm kind of curious, when you talk to people, being that you've got that naturopath and you've got the registered dietitian, when you have somebody with PCOS, obviously you were going to recommend inositol or dihydroberberine, but what else do you have them do lifestyle wise? Like if you have a patient that has this, she wants to lose 30 pounds, she's got the inflammation, she's got no periods and things like that.
Yeah, so there's a couple pillars that I think are critical. One is stress control. A lot of these women are so stressed out about getting pregnant. They're stressed out about their weight. They're so stressed out that that's one of the first things I address is like, let's get some of these modalities in, breathing techniques. Let's get outside in nature. Let's stop looking at our phones all the time. These things, sleep, I think is critical.
Oh
I think
yeah.
a lot of us are not sleeping near enough, and we
No.
expect our bodies to run well off 4 hours of sleep, and it just will not work. So I address sleep. I obviously strategically use the ketogenic diet. I teach keto as a tool, low carb as a tool, kind of depending on the lab values. So when I get my clients' labs back, if I'm seeing an insulin of 40, we're going to go keto. If an insulin's 6, we could probably get away with more paleo, low carb, just to get some of those hormones kind of regulated. So that for sure. I love a lot of the naturopathic therapies of acupuncture and acupressure and red light therapy and sauna. I think
Mhm.
being careful with cold plunging, but using it, even just if you're doing it on your face, is something I use. Um, all with my fertility and PCOS women as well. And then of course addressing any of the other things that are happening, like how Hashimoto's and PCOS go hand in hand. So
Yeah.
addressing some of the autoimmune stuff that sometimes comes alongside it, or even just thyroid conversion issues where your thyroid's kind of off because whatever reason. So addressing some of that too. Is all kind of it's a full body approach with my with my with my PCOS clients, and it works. I originally got into the ketogenic space as a weight loss dietitian.
Mhm.
To date, I've had over 60 women in my programs get pregnant, and it's like become this like secondary niche that I
Of course.
never intended it to
Yeah.
have because
Yeah.
when you fix the root cause of a lot of this, it allows your body to do what it's intended to do. And so it's just really, it's not, we have to do these intensive innovations, which some we do, right? But I believe in the body's innate ability to heal. And when you put it in the right
Well, that would be
environment,
why you're a naturopath.
yeah, yeah, you know it. And so it really just, I think, given the right supportive measures, it's really amazing how the body can kind of come back to what it was designed to be.
I think the fascinating thing, when that made me think, when you said that the body's natural ability to heal, it made me think of, as a physician, we kind of look at the body's natural ability to break down,
Hmm.
right? And it's interesting in a horrible way to think that that's how we work, because it's true. We are there to fix the breakdown, like a mechanic. Instead of changing the oil, rotating your tires, doing the things in the car that prevent the breakdown. I think we need both. I think you need people there if your appendix ruptures or whatever.
Yeah.
But at the same time, but your path, the path that you have to get these women pregnant, is harder. They have to do some work, right? And for me, I can just say, oh, well, I can just give you Clomid and I'll get you pregnant, and it might work, but it's not. And then they're at a risk for gestational diabetes and obesity and all these things. So, in closing, because I want to keep this, no pun intended, digestible. What would you say to women? Where would they start? And then, if they have PCOS and if they're trying to get pregnant, you've helped 60 women get pregnant. What would be a good place to start? And then, how do they find you?
Yeah, so I think figuring out what's the most realistic step for you in that moment is usually a good bite-size step to take. A lot of women when listening to this kind of stuff or health podcasts can get really overwhelmed with, I've got to do all these different things. And it's like decision fatigue or analysis
Yeah.
paralysis. It's like, I don't even know where to start. The first thing I would say that can make the most impact, and with most of my clients, is do your best to switch to real food. Get off the starchy carbs, sugar, sugary drinks, alcohol. Get off of that. If you can bring it back to nature as much as possible, that would be, I think, the most impactful first step. And then everything else really comes behind and supports a lot of that. I also would say, make sure you're looking at your individual needs in terms of root causes, because I think that's important as well in terms of, what do you need to triage? Are you not getting enough sleep? Are you in a bad relationship? Is your work keeping you, out all night? Like, what is it that it is really, you think, causing some of this dysfunction, and focus there. But ultimately I think some of the things we've talked about on this podcast, trying dihydroberberine, those kinds of things are going to be super impactful as well. I'm on all platforms at the.ketogenic.nutritionist. I have a very small podcast as well. It's in a work in progress, but I'm happy to help answer any questions that people have. So please, if there's anyone in the audience that has anything that we've talked about or questions on that, please reach out. I do my best to answer my DMs as much as I can with littles, but that's essentially where you can find me on all the things, as the.ketogenic.nutritionist.
Well, I will tell you, I've interviewed a lot of people, and you have been one of my favorites. I feel like I could do this for another hour, and you could teach me so many things. So go over to Instagram and follow her. She's only got 255,000 or so, but I'm just a pup with 80,000. You make me feel, talk about imposter syndrome. That's what I got. But thank you so much. For those of you that don't have the video, she has amazing hair, by the way. So
thank you. That's very kind.
The best hair. And so go to the ketogenic.nutritionist. Check out endurance products, dihydroberberine. I mean, anybody that's listened to me for 5 minutes knows I love maca and dihydroberberine. And it sounds like you do too. Temple, thank you so much for being on the podcast. I really, really enjoyed it.
Yeah, it was an honor. Thanks for having me.
Bye.